Hey, welcome back to Health Next. Please subscribe. Cystitis, also known as a bladder infection, is an inflammation of the bladder, usually caused by a bacterial infection. It is a common urinary tract infection or UTI that can affect people of all ages, but is more prevalent in women due to their shorter urethras. Cystitis can cause a variety of symptoms, including frequent or urgent need to urinate, pain or burning sensation when urinating, feeling of incomplete bladder emptying, lower abdominal pain or pressure, blood in the urine or what we call hematuria, cloudy or strong-smelling urine. Fever is also a symptom in some cases. The most common cause of cystitis is the bacteria Escherichia coli, some call it E. coli, which normally lives in the intestines. However, other bacteria and even some viruses or fungi can also cause cystitis. Bacteria can enter the urethra and travel to the bladder, where they can multiply and cause an infection. You should also know that there are several factors which can increase your risk of developing cystitis. The number one factor is being female. Women are more susceptible to cystitis due to their shorter urethras, which makes it easier for bacteria to reach the bladder. Sexual intercourse can also introduce bacteria into the urethra. Also, hormonal changes during menopause can make the urethra more susceptible to infection. Pregnancy can weaken the bladder muscles and increase the risk of urine retention, which can promote bacterial growth also. Next we got urinary tract abnormalities. Conditions such as kidney stones or an enlarged prostate can increase the risk of cystitis. People with weakened immune systems, such as those undergoing chemotherapy or organ transplantation, are more prone to infections too. Note that in order to diagnose cystitis, your doctor will likely perform a urinalysis, which involves examining a sample of your urine for the presence of bacteria, blood, or other abnormalities. In some cases, a urine culture may be needed to identify the specific type of bacteria causing the infection. Let's see how to treat this infection, but before we see that, help me do only one thing. Subscribe now on this channel for the hottest giveaways and exclusive free videos, and you don't have to miss this, trust me. Alright, let's see how we can treat cystitis. Cystitis is typically treated with antibiotics to kill the bacteria causing the infection. In some cases, over-the-counter pain relievers may be used to relieve discomfort. It is important to complete the full course of antibiotics prescribed by your doctor, even if you start to feel better before finishing the medication. I know some of you stop their medication course because they're feeling better instead of finishing the full course. You have to complete the medication. Okay, this is how to prevent this infection. You can take several steps to reduce your risk of developing cystitis, including practicing good hygiene, especially before and after sexual activity. Urinating after sexual intercourse. Drinking plenty of fluids to flush out bacteria. Avoiding irritants such as harsh soaps or perfumed hygiene products. Emptying your bladder completely when you urinate. If you experience symptoms of cystitis, it is important to see a doctor for diagnosis and treatment. Early treatment can help prevent the infection from spreading to your kidneys, which can lead to more serious complications. Thank you for watching this video at Health Next. More exclusive coming.